Our next guest is a mother of two children who were born with a rare bone marrow disease. Before Obamacare, her family averaged $10,000 a year in out-of-pocket costs. But in the last year, since Obamacare, that number skyrocketed to more than $27,000. So where's this great money-saving healthcare system we were promised by the president? Joining us now is Pattie Curran. Good morning, Pattie.
Good morning, Peter. Thanks for having me.
I'm so appreciative of you being here. You've written an incredible article in the Washington Times detailing the fight for life that you've taken for your family and for your sons. Let's talk about what's happened in terms of medication. In terms of co-pays, $131 for a 3-month supply for medicines in the past. Now, what are you paying?
Well, now we've been fortunate to get an exception, but it took us lots of paperwork and many years. It took us many years to find the right department to be able to get it. And if we don't get the exception, that would be $708. But we did have to pay a $532 copay several times before we were able to get the the pre-auth, the medical necessities exception.
Now, your sons face a rare and very dangerous, life-threatening disease that requires a tremendous amount of medication. Have some of the medications that they were receiving been discontinued as a result of the change in the law?
Absolutely. The Mito cocktail that they take for mitochondrial disease, we received letters stating that it would no longer be covered as of September 15th. And we then received a letter saying that we could not appeal unless our plan changed back. So we had coverage for the last, since 2005, we had the same insurance. So we just lost coverage for life-saving medications.
The out-of-pocket expenses that you've undertaken, they've almost tripled, up to $27,000. What effect has this had in terms of your financial condition? Your credit cards, I understand you've had to max out on some of your credit cards. Is that right?
Oh, absolutely. They're maxed out. We're currently looking at, trying to consolidate debt to do whatever we can do to, we have to obviously have more credit because we're not going to be able to afford these medications out of pocket ourselves.
What's the answer, Pattie? What's the answer for you and for other people that are facing this, especially when the president promised so much in creating this system where people that had very difficult diseases like your children would be given the care that they were needed at a cost that would save families money? What, in your mind, is the solution today?
My solution would be the free market, opening up the insurance companies, allowing them to compete across state lines, and allow the free market. Less government control means that costs will come down for everyone across the board. So I support a free market solution.
Are you afraid that your children could die if you were not able to keep up this payment of dollar after dollar after dollar? I mean, do you worry that it's $30,000 this year, that maybe it's $40 or $50 or $60,000 next year?
No, absolutely. It's a concern. The doctor wrote a letter trying to get the medications covered, and death is a possibility. We live day by day. We're doing what it takes to get the medications because, I'll stand up for my children and I'll do whatever it takes to make sure that they get their medications.
The burden on the family is a great one, especially when people are sick. Do your children understand the burden that's been created by Obamacare?
Yes, they do. We're homeschoolers, so they're well versed in the Constitution, and they understand that Obamacare was unconstitutional, and they do understand the burden that's been placed on our family. Though we've told them not to feel guilty, that we're coming forward to speak out, and it's difficult for them that I'm speaking out, but they understand the necessity because we have to stand up against